Now finally we are making the things more complicated for you, and again there is one more scenario. Now the 45 years old male patient underwent the Whipple procedure, and the operative time was 6 hours, and the pre-operative parameters, they were normal, and you are asked to write his post-operative fluid. So now proceeding towards this scenario, this is to somehow complicated. The information we have given that the weight of the patient, it's 40 kg. Sorry, it's 60 kg. So the weight of the patient is 60 kg, and the pre-operative status like HB, hydration, sodium, potassium, they were totally normal. Okay, and the per-operative status, here you will focus the maintenance fluid. We will multiply the weight with the 40, it will become 2400 ml. Definitely this 2400 ml, it's for the 24 hours, and we will divide this 2400 by 24 to calculate the fluids in 1 hour. And as the operative time was 6 hours, and we will multiply it with the 6, so it will become almost 600. Okay, and the sodium, definitely 1 milliequintal per kg. So in a patient 60 kg, so its value will be 60 divided by 24 for 1 hour, and we will multiply it with the 6 to calculate the sodium to be given in 6 hours, that's the 15 milliequintal. And the third space last, as it's a very large NCN. So in the previous slides I told you that its value is 9 to 11 ml per kg per hour. So we have taken the value 11, and we will multiply 11 with 60, and with the time, that's the 6 hours, so we will be having the value 3960. Okay, and ongoing losses in the NG in the 6 hours, it's 500 ml. So in the NG the fluid is 500 ml, and the sodium, it's 35 milliequintal. In the previous sections I have told you that you can use the crude method by secretions, you can calculate the electrolytes deficit. So blood loss in this procedure it was 900 ml. Okay, so proceeding, the total fluid requirement, that's the 5060 ml, and sodium, it's 50 milliequintal, and the blood loss, it's 900 ml. And due to certain reasons blood was not available, only one blood was available, so we have given the 450 ml blood, and we have given the fluid ringer lactate 3 liter, and we have given the normal SNAN 1 liter. So 500 ml is deficit from here, and 450 ml is deficit from here. So I have mentioned this thing because I have to replace this fluid in the post-operative period. So that's why I mentioned this. I have mentioned this thing here for your simplicity. So here, finalizing the things, total fluid required, it was 5060 ml, and sodium 50 milliequintal, and blood was 900 ml. And as we have given the ringer lactate 3000 ml, normal STAN 1000 ml, and the whole blood we have given the 450 ml. So deficit is total 1060 ml, and injection whole blood or infusion whole blood 450 ml. So now we have to calculate the post-operative fluid, and we will keep this patient NPO for 4 to 5 days, but 6 hours they spent in the operative period. And now we will calculate the fluid for 18 hours, and after that from the next day from 8 we will calculate from 8 to 8 24 hours. But now 6 hours have been passed, and we will calculate the fluid from the 2 to 8 for 18 hours. So the post-operative NPO required is 24 hours, and the maintenance fluid, we will multiply the weight with 40, it will become 2400. Okay, definitely 2400, it's for the 24 hours, and we will divide it by the 24. So we will get the value for 1 hour, and we will multiply that value with 18, and our value, it will be 1800. And electrolyte sodium 60 divided by 24 for 1 hour, as we have to give it for 18 hours, so we will multiply it with the 18, and it will become 45 milliquintal. And the per operative deficit was 1000 ml and 450 ml of the blood. So we will replace it in this post-operative period, which was deficit in the per-operative period. So with this, finally, hope you have understood something. If you have understood something from our videos, then do subscribe our channel Surgeon Dr. Amir Gilani for more educational content. So thank you so much.